I'm going to have a little discussion today about carpal tunnel syndrome. Carpal tunnel syndrome is a condition that affects the hand, actually the middle of the hand right through the carpal tunnel being right here. Most people that come to me have been self-diagnosed with carpal tunnel because they have symptoms into the hand and they've either heard somebody talk about it or know of it and think they have carpal tunnel. And some other ones have actually been diagnosed by a medical professional that they have carpal tunnel. In those cases, almost every time that I have somebody come in here, they don't have carpal tunnel. Actually, in fact, I've never seen one that really had true carpal tunnel syndrome in 15 years of practice. That being because the carpal tunnel is right here, and that is only one nerve that goes through it. The median nerve comes out through the neck, goes down the arm, and down into the hand here. But that's only part of the problem with people, is that because there's also the ulnar nerve comes right through here, and the radial nerve comes down this side and go into the hand. So there's three different nerves that can cause pain and numbness or tingling into the hand. So it's not always just the carpal tunnel syndrome because it's not always the median nerve. Most of the times when the median nerve is actually affected, it's not affected at the carpal tunnel, it's actually affected up into the elbow or the shoulder. Most of the times being the elbow. That's because people use their arms so much. You know, there's assembly line workers that are always doing the same thing, moving their arm the same way. Or it can be somebody that's working on the computer that's always using their mouse. This little activity actually can be very stressful for the arm. And it can be like a mechanic that's always twisting. Those muscles get really tight and overused. And when they get overused, they get weakened and the body puts down scar tissue. That scar tissue actually sticks the nerve to the muscle. So every time they do twist, reach, move, that nerve gets pulled. When that nerve gets pulled, it's going to get irritated. When it gets irritated, it's going to send some numbness, tingling, pain down the arm into the hand. Now there's 5 spots the median nerve can get pinched, only one of them being the carpal tunnel. And the carpal tunnel, in fact, is the least likely of those ones to get the nerve pinched at. So what I do is I work with active release technique, or ART. And that technique is used to add motion into those joints, into those muscles, and pull that nerve through it. So I can actually hold the muscle, stretch the nerve, and move that through that tissue to make sure it doesn't get pinched anymore. I've seen many people that have actually went and had carpal tunnel surgery for their symptoms and actually didn't get any relief because the problem was up in here. If you take care of that problem up in here, you don't need the surgery, don't need all the hassle. It's a much easier treatment, much easier recovery, and you can avoid the surgery.